Hey everyone, if you or someone you love is fighting cancer, you've probably come across the term Integrative Oncology. Today, we're not talking about some alternative therapy that tells you to ditch chemo and just drink herbal tea. We're talking about a genuine, powerful ally that works alongside modern medicine, traditional Chinese medicine, TCM. In the West, a lot of people think TCM is just acupuncture or mysterious plants. But at leading cancer centers like Memorial Sloan Kettering and MD Anderson, TCM is recognized as a sophisticated human ecosystem regulation system. If you think of cancer treatment as a war, Western medicine, surgery, chemotherapy, radiation, is the precision strike force targeting the enemy. TCM's job is to protect the civilians caught in the crossfire, your healthy cells, and repair the land after the battle. Today, I'm going to walk you through the 5 core ways TCM supports cancer treatment. The first direction, toxicity reduction. Chemo and radiation are incredibly effective, but they can work like carpet bombing, creating a huge amount of collateral damage. Bone marrow protection. Chemotherapy attacks your bone marrow, causing white blood cell counts to crash. In TCM, we see this as damage to the middle jiao. We use herbal formulas to optimize your spleen and stomach function, essentially installing a fast charger for your blood-forming system. Nerve repair. Many patients experience numbness and tingling in their hands and feet after chemo, and what's called peripheral neuropathy. In TCM, this is classified as cold stagnation. Through herbs that warm and unblock the meridians, along with acupuncture, we can improve microcirculation and protect your nerve endings. One-line takeaway, TCM isn't interfering with your chemo, it's suiting your body up in a bulletproof vest so you can make it through the entire treatment course. The second direction, symptom management. Cancer treatment has a lot of gray zones, symptoms that Western medicine sometimes doesn't have great answers for. For example, cancer-related fatigue, CRF. This isn't the kind of tiredness that a good night's sleep fixes. It's a systemic energy collapse. TCM sees this as qi and blood deficiency. Through targeted treatment, we help rebuild your body's internal battery, its capacity to store and generate energy. Appetite and metabolism. When you have absolutely no desire to eat or when everything tastes wrong, TCM steps in to regulate your earth element and the spleen and stomach system responsible for digestion and absorption. The big picture here, we're not just focused on extending lifespan, we're focused on improving the quality of every single day you're living. Because if you can barely get out of bed, the treatment itself loses half its meaning. The third direction, perioperative care. Surgery is a physical clearance, but it leaves behind massive physiological trauma. Reactivating the gut, post-surgical ileus, when your digestive system shuts down, is a nightmare for many patients. Acupuncture and specific qi regulating herbal formulas can act like a switch, rapidly rebooting your digestive system. Lymphatic drainage. This is especially relevant for breast cancer patients dealing with limb swelling after surgery. TCM uses methods that transform stasis and drain fluid. Think of it like clearing a city's clogged drainage pipes to help the swelling subside. The goal of all of this is simple: to get you back to the dinner table with your family as quickly as possible after you walk out of that operating room. This is arguably the most important direction: recurrence prevention and long-term recovery management. Imagine your body is a garden. Cancer is like poisonous weeds that have taken root. Western medicine pulls out the weeds and sometimes removes some of the surrounding soil too. But if that soil remains dark, damp and depleted, the weeds are going to grow back. TCM's role is that of the gardener. We work to improve your body's soil, your biological microenvironment, through treatment that makes your body a less hospitable environment for cancer cells to thrive in. We also incorporate what I'd call neuroimmune exercises, practices like Ba Duan Jin, 8 brocades, and Tai Chi, which regulate the vagus nerve and help lower the body's baseline level of chronic inflammation. The fifth and final direction is also the most deeply human one: palliative care. When cancer reaches an advanced stage and aggressive treatment is no longer appropriate, TCM shifts its focus toward living with tumor, supporting quality of life alongside the disease. Relieving pressure. For patients suffering from pleural effusion or ascites, fluid buildup in the chest or abdomen, we use warming and draining methods to ease the sensation of breathlessness and distension. Slowing the decline, we work to protect whatever energy the patient still has and to slow the progression of muscle wasting, what's medically known as cachexia. In many cases, when we stop fighting aggressively and instead let TCM gently support the body, something unexpected happens. Patients often live longer than predicted and with far greater dignity. Let's wrap up. TCM is not magic. It is a science of balance. If you're considering adding TCM support to your treatment plan, here's my practical advice. Identify your stage. Where are you right now? Do you need the bulletproof vest? Or is it time to start tending the soil? Find the right specialist. Make sure you're working with a licensed, oncology-informed, integrative medicine practitioner. Stay transparent. Always keep your oncologist informed about everything you're taking. Cancer has changed your life, but it does not get to define your future. Through the integration of TCM and Western medicine, we're not just fighting the disease, we're reclaiming the vibrant, energetic version of you. If this video was helpful, please subscribe and share it with someone who needs it. Together, with wisdom and courage, let's rebuild your health.